Dental Hygiene Throughout the Lifespan by Susan Kuntz, Katie Wilkerson, and Kayla Bradley.
Proper dental care is important for all age groups. It begins with maternal dental care before and during pregnancy and lasts throughout the lifespan. The focus of early dental care is to preserve the health of the primary teeth until they are lost and replaced by the permanent teeth. The focus then shifts to preserving the health and function of the permanent teeth. The biggest threat to teeth is dental caries, which usually occur during the early childhood years, such as toddler, preschool, and school-age years. In this presentation, we are going to discuss proper dental care and ways to prevent dental caries.
Dental care in infancy begins with the appropriate maternal dental health and nutrition. When the first tooth erupts, cleaning with a soft, damp cloth should begin. When more teeth erupt, a small, soft bristled toothbrush should be used to clean all surfaces of the teeth. At 6 months of age, infants should see a dentist, and fluoride supplements should be given if the child is not getting water with fluoride in it. To avoid dental caries, fruit juice should not be given in bottles, and bottles should not be propped, and bottles should not be given in bed. Nocturnal breastfeeding can also contribute to dental caries, and cups should be encouraged at 12 months of age. The use of a pacifier has been associated with an increase in ear infections. Parents should limit the use of pacifiers in the second 6 months of an infant's life. That the infant should be completely weaned off of the pacifier by 2. Thumb sucking after the age of 4 or 5 can also cause malocclusions of the teeth. Dental care for toddlers should be performed by the parents. Parents should brush the toddler's teeth after every meal and before bed with a small, soft-bristled, rounded toothbrush with short, multi-tufted nylon bristles that are uniform in length. Flossing is also an essential part of dental care for toddlers. At 2 years of age, fluoride toothpaste should be introduced. A pea-sized amount is sufficient. After brushing with fluoride toothpaste, avoid rinsing the mouth out. Only water should be given after bedtime brushing. To avoid dental caries, sweets should be given with meals, not as snacks between meals. Water should be given at bedtime and nap time. Give juice in cups, not bottles. Eliminated bedtime bottle completely. Do not use bottle as pacifier and do not coat the pacifiers in sweet substances. Fluoride supplements should be considered, but not given without instruction from the dentist. By 12 months, toddlers should have an established dentist. Toddlers should be drinking from cups by 14 months, and extended bottle feeding is associated with early childhood cavities. Preschoolers still require assistance and supervision with brushing their teeth and flossing. The risk for trauma to the teeth is big during this stage. The risk for trauma to teeth increases in this stage due to the lack of inhibition in the child. Preschoolers are more prone to fall or jump off of things than children of any other age. Thumb sucking and the use of a pacifier in the preschooler years can cause malocclusions. Malocclusions can cause problems with chewing. Dental care for school-age children becomes more independent. The children should be taught correct toothbrushing techniques while monitoring their toothbrushing efforts until the child can assume full responsibility for their own teeth. During the school age years, the primary teeth start to fall out and the permanent teeth start to grow in. Molars come in around 6 and 12 years. When the 12-year molars erupt, most teeth are present. Malocclusion problems caused by irregular eruption of permanent teeth that can impair function must be watched for. It is recommended that school-aged children see the dentist every 6 months. Fluoride supplements should still be considered for this age group. The most common problems in this age group are cavities. Cavities is the number one problem in children, and if it is untreated, they can result in the total destruction of the involved tooth. Cavities are contagious. The second problem in this age group is malocclusions, which occurs when the upper and the lower teeth do not line up. It can cause cosmetic effects and it can cause less functioning of chewing. The third problem in this age group is periodontal disease, which is an inflammatory and degenerative condition that involves the gums and the tissues. The most common type of periodontal disease is gingivitis. If malocclusions are noticed at this age, a referral to the orthodontist should be considered. The earlier the treatment, the better chances that deformities can be corrected. Dental injuries occur in this age group, which include fractures, chipping, dislocation, or avulsion. If a permanent tooth suffers trauma and becomes avulsed, the tooth should be cleaned and reimplanted, and the child should be taken straight to the dentist. Although the risk of dental caries decreases in adolescence, dental care is still important. Adolescents should be evaluated for dental caries by a dentist every 6 months to a year. Pitt and Fisher sealants are effective in prevention of caries. The use of corrective orthodontics, if needed, occurs in early adolescence. Proper care of orthodontics and proper toothbrushing with orthodontics should be reinforced. During late adolescence, the third molars or wisdom teeth should be evaluated to ensure proper management.